had lumps, and it was scary. And we're doing this story for those who have lumps, will get lumps, will have to deal with having lumps. And lumps is anywhere, but for me, it was in my left breast. And I've decided to share this journey with you because I can understand why so many persons are scared, why families are in tears. But to let you know, it for sure is not a death sentence. You want to ensure that you have the right attitude when a doctor says you have lumps. And that was scary, that one sentence where we are feeling lumps. And therefore I want to show you individuals who kept me calm, individuals who were there to heal me from those lumps and to continue to help me on the journey with those lumps, and to let you know that right here in Jamaica Land We Love, we have absolutely excellent practitioners, health practitioners who know what they're doing. They do it every day. You're not aware of it. You don't hear the story. You usually hear the horror story. You're going to meet, of course, the doctor who removed them. What did the process entail? Get ready to be a part of my lumpy journey. And here we have somebody who is absolutely dear to my heart, dear to my breast, is what I want to say. Doc, how are you doing?
I'm good, you know. How you do?
I am blessed,
well?
but I don't know if I'm good. You always are the one that helps us to be good. And we wait on those calls when you send those texts, as you can sense that we do.
Yes.
But what you do is oncology.
Yes.
Who's an oncologist?
So I am a surgical oncologist. There are various types of oncologists. So oncology is a subspecialty of medicine that deals with cancer, either cancer research, cancer care, etc. There are different types of oncologists. So we have medical oncologists who give chemotherapy to treat cancer. We have radiation oncologists who use radiation to treat cancer. And you have surgical oncologists who are surgeons specialized in doing surgery with special cancer techniques or techniques to remove the cancer.
How long you've been doing that? Why should we trust you?
So I have been a surgical oncologist since 2011. So that's 13 years.
Beautiful.
I don't know if that's long enough for them to trust me.
Yes, for Jenny to trust is long enough for me for sure. But talk to us in terms of what you've discovered. We have more persons. I came to you with my lumps, not one, but two. Are you finding more and more people getting lumps? Is the number increasing? Is it decreasing?
Yes, I think we're finding more, but that doesn't necessarily mean it's because more women are forming lumps. I think as standards of living improve, people are having access to mammogram, ultrasound. Also, the word is getting out, so persons are becoming more aware of their body. You know, people are examining themselves, seeing their family doctors, etc.
But you didn't find my lump.
Yes.
That bothered me that you couldn't feel my lump. You did all of what you were supposed to do. How come you didn't
Well, that's excellent. That's the stage we really want it at. We don't really want to wait until persons are able to feel a lump or the doctor is able to feel a lump. We would love if every woman, once they reach the appropriate age, could go and get a mammogram and ultrasound done every year, and for us to detect that lump before it's palpable, which was your situation.
Right.
Because the smaller it is that we detect it, the greater the chance of a cure if it should be cancerous. And also the cheaper the cost is associated with cure, shorter time.
Doc, it's not cheap at all. Everything costs way over $1 million. So we don't know about no cheaper.
Well,
there is no cheaper in this.
Not the cheaper way out. If you had presented more advanced, it certainly would have been more.
Wow.
It's just the reality of life.
Right.
The earlier things are diagnosed, the cheaper it is, the more options we have to as well. The shorter the time is in hospital. I can't remember. I think you went home the same day.
The other day, Doc, you told me I would go home and I couldn't see me big toe. I felt very drunk.
You enjoyed the sleep from the anesthesia, but I told you it would have happened.
I did. When I came to you and I told you I have lumps, what went through your mind?
Well, you know, we always take a few things into consideration. Obviously, race, you know, we're Black people, and unfortunately, Black women tend to get breast cancer and tend to get more aggressive type of breast cancer. So, you know, once you're over age 40 with a breast lump, that is
How come you're reassuring? reassuring. You don't know what's happening in my body. I'm only telling you what I'm feeling, but yet you were reassuring.
I was
How come?
reassured for multiple reasons. Your mammogram and ultrasound was done by Dr. Cornwell at Precision Imaging,
She's
and
good.
she's someone who I have a lot of respect for. And I read her report, and she was not very concerned by the report. In addition to that, she went on and she did a biopsy, but just the features that she described, I didn't think it was cancer. Grant, you have been wrong, many times. But at the end of the day, that initial biopsy we had for you before the surgery did not show cancer. So that was even more reassuring that the final results likely would not be cancer.
So why then remove them? Why then slit half the breast to see and to ensure? Why is that important?
Well, in your case, we were working with that diagnosis based on the biopsy, and it was a diagnosis where we know that there is that 20% possibility that cancer could be lurking in the area, and for some people, 20% is just a lot.
It's a lot,
and I think medically that is a lot. So the pathologist, made a comment that this area should be removed. So though the initial diagnosis or the diagnosis leading to surgery was not cancer, there are concerns that we should remove the area for two main reasons. One, the possibility that cancer could be there, or two, if cancer is not there, that this diagnosis is something that could lead to what we call a precancerous. It could lead to a cancer.
You're fancy.
In terms of?
Absolutely advanced and detailed. I didn't even know that in Jamaica we have these things called markers.
Yes.
And then you go and you use the markers to go to the exact spot to do the removal. Tell us about that process.
So you had two types of markers. You, at the time of what we call a core biopsy, which is a big needle that goes in and takes out a sliver of tissue.
I had to take a deep breath
really?
and not think about it. Don't you think about a big needle going straight through your breast? It can be different. You just have to change your headspace.
It's a known thing, it's three things Jamaicans are afraid of: chemotherapy, lizards, and needles.
And needles.
The baddest gunman will run once you come in a needle.
Our lizard.
Our lizard, they run, leave them gone.
Yes.
So I'm not surprised. But you had, anesthesia, local anesthesia to the area, which we always do whenever we're doing this core biopsy, because you shouldn't feel anything. So yes, there's that clicking sound from the biopsy needle, which, a lot of my patients will tell me is probably just as sound is as if they're feeling
click of
pain.
death, almost,
exactly.
Yes.
And it's quite a few clicks, on average at least 6 clicks.
Yes.
To get a good sample of the area.
Right. Mm-hmm. So, but and Jamaicans are not aware that we're this advanced. A lot of persons will go overseas for treatment rather than here because they don't know we're this advanced.
Yes, and I think I didn't actually answer your question about the markers. So yes, at the time of the biopsy, we left a marker because we don't know what this lesion is that we're biopsying. So in the event that this biopsy should come back and it is something that we need to act on, like we need to remove, etc., then that marker will guide us as to where the lesion is. Because especially in a case like yours where this thing was tiny, less than a centimeter, if we don't mark it and we're now taking out pieces of it with the biopsy, then we're now down to even a few more millimeters. It could be hard to find. And though it's that small, if we don't mark the area and the final results come back saying that it is a cancer, then sometimes, even though your diagnosis is minimal, we now have to remove this breast because we can't find it, which is, which is unfair for you to have a minimal diagnosis of cancer, for want of a better terminology, and we're now doing maximal therapy, which is removal of the breast. So we left that initial marker so that we could go back and identify the area. Now, after your results came back and we decided that we need to remove this area, what we did for you was called a Molly marker. So this is a new technology, and the only other country in the Caribbean that Molly is available is in Cayman. And to the best of my knowledge, in the Western Hemisphere, it's just Jamaica, Cayman, Canada, and America. This was recently invented 2 years ago by the Canadians. And
we're right on the mark.
We're right on the mark. We thankfully were able to get it into Jamaica from 2023, as shortly after it was released on the market. And the Molly marker is really a special magnet, about 3 millimeters in size. And it again will be placed by the breast radiologist. And then we have this tablet and a wand. So we will hold the wand over the breast at surgery, and the wand will tell us exactly how far we are far from that molly marker that was placed. And it gives us, the breast radiologist will give us the coordinates in terms of how much breast tissue we need to excite in each direction, how much towards the foot or towards the head, to increase the chance that when we do excise this lesion, we're getting it in its entirety.
So when you put me under to do the operation, and you cut the breast and you start looking for the lumps or following the molly marker, because that's what you did. Did you have any surprise? Was there anything else that bothered you?
No, we didn't. And you know, especially when you're going for lesions this small, we can't see anything. And
you're just cutting tissues.
We're just cutting tissue, and it literally looks like fat. And to be quite frank with you, when you're doing a lumpectomy, removal of breast tissue for anything, whether it be a cancer or not, especially if you're suspicious of a cancer, you don't want to see anything, because the aim is to remove this lesion with a rim of normal tissue. So if you're cutting and you're seeing what doesn't look like the normal tissue, that's a possibility that you're cutting into the tumor, which means that you're leaving a piece behind, and that defeats the entire purpose of surgery. The aim of surgery is to remove this thing in its entirety with a rim of normal tissue around it.
Talk to women who have cancer, talk to women who have lumps, talk to men too.
Yes.
Because I'm sure you treat both males and females. What are some of the things, if you were to give them 3 advice? So 1, if it is that they feel a lump. 2, after they've done that, because you tell me, of course, do my mammogram every year.
Yes.
So I'm going to be doing mine every year. So don't bother add that. What are some of the things you'd like to talk to them about?
We would advise patients, 1, to be aware of their body. And if you find anything that is abnormal or unusual, to seek medical attention. You know, we have a very rich culture of persons giving advice, and anything you tell your friends, they know someone with exactly the same thing. And sometimes, you know, the intent is good, but it can be a problem. So seek professional help. And the next thing I've discovered is that a lot of us really don't know our family history. And that's very important. And the Jamaican family, most times, is dispersed all over the world, some in America, some in Canada, some in UK, etc. And as a result of that, you know, we're probably not fully aware of our family history. And that is very important, because oftentimes it is after when a patient is diagnosed with cancer, they start to discuss it within the family circle, that they're aware of how many cousins and aunts and etc. So knowing that family history is very important. And I think the third thing is to have a doctor. At this time, when we talk about a family doctor who you can trust and who you should be seeing regularly, especially when they reach a certain age. It's not just cancer. It is the diabetes, it is the hypertension, it is all the lifestyle modification and changes and monitoring that we need to do. And I think if we do those things, aware of our body, aware of our family history, seek medical attention when it's appropriate, I think things could be much better. That would be significant advancement from our end as it relates to breast lumps and breast cancer. You know, for the men, it's a little bit different, because, you know, we Jamaican men tend to be, you know, special.
Much.
You know, seeking, it is a known fact, and it's not just Jamaica, but elsewhere in other countries, that women tend to have much better health-seeking behavior than men. And as a result of that, there is no country on earth that men live longer than women. In every single country, women live longer than men. Now, we could have a 7-day discussion as to why. But professionally, we'll tell you that women have, you know, and it's not that you guys are stressing us out.
We just go sit there.
Yeah. But yes, breast lumps, as it relates to men, tend to present oftentimes more different, because you know, the incidence of breast cancer in men is less than 1%. As a result of that, you know, we don't normally screen for breast cancer in men doing mammogram, etc., unless this person is known to have a genetic abnormality that would put them at risk for getting breast cancer. So as a result of that, most men with breast cancer, when they present, it's a bit advanced. The lump tends to be bigger by the time it is attached to the skin or attached to the chest wall, because they don't have as much breast tissue as women. So breast cancer in men is not common, but when we do discover it, it tends to be at an advanced stage. So I would advise every man, if you should feel a lump in your breast, seek medical attention immediately and don't wait until it's too late.
You've been wonderful, and I want to thank you. I want to use this opportunity. I can't believe it. At the time when I was very tense, we were jamming and jiving and talking about life and family and school.
Yes.
Can't get the school out of that. That helps. And then, of course, in terms of your team, you have a great team. Your nurse is fantastic in terms of before the operation, and then the aftercare was fantastic. Yes. Dressing the wound was great. Checking up was fantastic.
Yes.
I feel like family, and I'm very happy I have an oncologist.
You are
I don't
family.
need you again.
You're family, and all our patients are family. And, I thank you for mentioning the team, because I don't want to take credit for everything. The assistant surgeon was Dr. Leopold Powell. Yes. The anesthetist was Dr. Patrick Toppin, and Nurse Blake and the team at Vein Centers were the ones responsible for doing your dressing. And yes, it's a team effort.
And you took me to Tony Thrace, which was really wonderful. Yes. The nurses there were fantastic.
The nurses and the support
My
staff.
Goodness, it's every dollar well spent.
Yes. I'm glad you had a good experience.
I did. And I hope I don't have more long.
We don't always get it right, but we try to, at least most of the times, to get it right.
And I want to thank you.
You're most welcome.
Big hug. The man who saved me from 2 lumps that could be bigger and could definitely be devastating. And it was rough times, lots of praying during that time, lots of trying to distract self, because you have to distract self to say not too intense during that time. But thank you for the calm head. Thank you for your sense of humor, your wit, and that you make sure to keep us relaxed in that setting. You're very good at what you do. I barely have scars. I can't strip and show you now. But if I take on and put on my 2-piece, I'm a swimsuit, you're not going to see anything because it looked big then, it was scary. But it has healed so well, and I want to thank you.
You're most welcome.
And let me see your hands.
You're most welcome.
May the Lord continue to bless these hands. Thank you.
Thank you.